Hi everybody, Dr. Daniel, and today I'm talking about migraine and fever. Well, migraine is a genetic and familial neurologic problem present in 13% of the American population, and usual symptoms are one-sided severe throbbing pain and sensitivity to light, sound, and movement. Most patients have nausea and or vomiting. Migraine is the most common medical problem for women, present in 25%, and the most common symptom of migraine is that it is one-sided. So it is rare for a migraine attack to have fever, and an underlying infection is usually the cause. The fever should be aggressively worked up, and the patient should see their general doctor. So associated questions: is the headache with fever like a migraine? The fever headache is on both sides of the head and mild to moderate in intensity. It feels like pressure, pulsing, stabbing, or dull. It is not the severe, one-sided headache like migraine that puts the patient to bed with nausea, vomiting, and prostration. What types of infection may cause migraine with fever? COVID-19 right now is the most common thing, and that usually starts with fever on both sides of the head, which is mild, moderate, and non-throbbing. Influenza, also called the flu, is caused by the influenza virus. Although sometimes mild, the infection itself with its associated generalized headache may be severe and lethal for older persons and babies. Flu also has muscle aching, a runny nose, cough, fatigue, and sore throat. It may be treated with rest, mild painkillers, and cough medicine. Severe patients may benefit from antiviral drugs if treated early in the course of the illness, and which reduce the severity and duration of the illness. The Epstein-Barr virus. This virus causes mononucleosis, a common infection in teenagers. It is spread through bodily fluids, particularly saliva, which promotes the name for young romancers, the kissing disease. Epstein-Barr virus may cause headache, fever, body aching, severe tiredness, and sore throat. Headache here is much like tension-type headache. Treatment is rest and hydration. Sinus headache. Well, that term was created by the Sudafed industry back in the 50s, who made Cyanide and other over-the-counter headache medicines that have Sudafed in them. There really is no legitimate sinus headache, and that name is not in the Third International Classification of Headache. But there is a thing called acute rhinosinusitis, which presents with frontal, behind the eyes headache, fever, and green and yellow nasal discharge. The illness may commonly occur after a cold. Plain x-rays of the sinus may be diagnostic, and the patient's treated usually with a course of antibiotics. And acute rhinosinusitis may also have accompanying symptoms of face pressure pain, sore throat, cough, runny stopped-up nose. In addition to antibiotics, treatment is decongestants, steam or warm compresses. Familial hemiplegic migraine. Now, this is one known reported migraine condition that's associated with fever. The diagnosis here can be made by a genetic assay, and the symptoms, according to the International Classification of Headache Disorder version 3, is made according to the following criteria. You got to have 2 attacks. Each one has aura with motor weakness accompanied by either reversible visual symptoms like flickering, lights, spots, lines, or reversible sensory symptoms, pins and needles, numbness, or speech symptoms. And you need to have at least 2 occurrences of 1 or more aura symptoms that develop over at least 5 minutes. These symptoms lasting more than 5 minutes and less than 24 hours. That's the usual deal. Headache beginning within 60 minutes of aura onset. These headaches can last 4 to 72 hours, occur only on one side of the head, and they pulsate. They're moderate and severe in intensity and may be aggravated by common physical activities such as walking. These headaches must also be accompanied by nausea and vomiting, sensitive to light and sound. And at least one other close first or second degree relative must have familial hemiplegic migraine. That's partly how you make the diagnosis. There's no other cause. There are sporadic forms which follow the same diagnostic criteria with the exception of family history. Severe attacks of hemiplegic migraine can lead to fever, seizures, or coma. And familial hemiplegic migraine has known genetic involvement. I have an article about that on my webpage at drmigraine.com. The meninges are the plastic-like tissue that surrounds the brain. Medical students are taught the following patient has fever, headache, and stiff neck. That's a cardinal signs of meningitis, and they need a workup, including a spinal tap. Infection, immune disorders, or cancer commonly cause meningitis. And meningitis is a serious, life-threatening condition requiring emergency medical evaluation and a spinal tap, as mentioned. Symptoms of meningitis are neck pain or stiffness, sensitivity to light, headache, confusion, nausea, and vomiting. Encephalitis. Well, the brain is called the encephalon, and brain inflammation is encephalitis. This is a rare but extremely dangerous disease, and early symptoms are high fever with headache followed by confusion, an epileptic seizure, personality change, trouble talking, and loss of consciousness. Viruses that cause encephalitis are the herpes virus, HSV1 and 2, Epstein-Barr virus, varicella zoster virus, poliovirus, Coxsackie virus, West Nile virus, La Crosse, and the St. Louis virus, Western and equine viruses, Powasian virus, rabies virus, measles, rubella, mumps, and general measles, which is rubella. Now, a tricky thing that can cause fever and headache can be missed, it's difficult, is a dental abscess. Infections that get gums are really tricky, but that can cause headache and fever. What you have here is a collection of pus in the teeth or gums, and it results in bacterial infection around or in the tooth. Should be evaluated by dentists, treated probably with antibiotics. A cancerous tumor. Cancer of any kind can be occult and may cause diffuse headache and fever. Also, the patient who has migraine and fever, in our outline as we're talking about here, should have an accurate diagnosis of migraine. And to do that, you need at least 5 attacks to make a proper diagnosis of migraine. Migraine is a primary headache disorder with recurrent moderate to severe headaches, which may be one-sided, throbbing, or pulsing, and associated with nausea, vomiting, sensitivity to light and sound. As a real migraine lasts 4 to 72 hours, and they are worsened by activity, and the affected person wants to lie down or go to sleep. They don't want to work or get up. 30% of patients who have migraine have an R, a warning, that comes with a headache, which is usually visual, but may also be numbness on one side or trouble speaking. Sometimes the R comes with small or even no headache, and that's called migraine with aura. Migraine attacks may also be generalized instead of being one-sided. And they be located in the temples, behind the eyes, on one side. Sometimes they start at the back of the head on one side and then come forward into the front of the head, behind one eye. Migraine and tension-type headaches are 99% of headaches that occur. Tension-type headaches are usually mild to moderate in intensity. They're bilateral, which means on both sides of the head and in the back of the neck and shoulders. They feel like tight or squeezing. Another thing we need to have straight here with this talk is that fever diagnosis should be certified with a thermometer. And temperature should be rated 100.4 degrees Fahrenheit or more. That's a fever. Now, there are rare cases in the neurology literature, and I've seen several myself in practicing neurology and headache, of fever caused by migraine. An example of one of these is Carlos et al., who wrote an article in Pain Medicine in 2013 on the increase in body temperature during a migraine attack, and they describe a 15-year-old girl who had something like that. So there are rare cases of temperature that's increased with migraine. As in the case I just discussed, very rarely migraine will come with elevated temperature. This is usually called a fever, but some writers do not want to use this word, and so they call it elevated temperature. And elevated temperature is considered related to migraine, either as a migraine equivalent or what they call a migraine accompaniment. My concluding thought is then, fever with headache is almost due to infection. Rarely it may be due to migraine. God bless all you folks who have migraine and headache. Please click like and subscribe down there, and I'll see you again on the next talk.